Well, we're talking wellness now. It's easy to know when we are sick, but how do we know we are really healthy? Here to explain is Dr. Dane Donahue of 8 Weeks to Wellness. Good to see you, sir.
Good to see you.
Indeed, indeed. Now, we know when we're feeling good, and we don't feel good, rather. We have symptoms, and we know we're sick. But how do we know when we're healthy?
This is a great question, and Isaac Newton taught us the real good principle a long time ago, and that is for every action, there's an equal and opposite reaction.
Right? Mm-hmm.
Right? So that's the law of cause and effect. And in our society today, we focus on effects. Those are symptoms, those are diagnostic tests. So we know when we're sick or we know when we have a diagnosis. And remember, most people are dying of heart disease, cancer, diabetes. All these are kind of silent killers. Mm-hmm. So how good is it to know when we're well? And in our office, we use something called a wellness score, where we're not necessarily focusing on symptoms and sickness. We're going to focus on how healthy is a person, how resilient is that person, so they never get a disease in the first place.
Break down that focus. Tell us more about this wellness score.
Okay, so wellness score looks at physiology. And again, in our practice, we always say to our patients, physiology doesn't lie. So your blood pressure is your blood pressure, your BMI, your body mass index. Looking at things like functional fitness, how a person is moving. Looking at things like their nervous system and how is their nervous system adapting to stress, because we all have stress. So we put these all together in a puzzle, and it gives us an overall grade or a wellness score for our patients to know how resilient is that person. Are they doing a great job at preventing things like heart disease? Because think about it, Yuki, nobody wakes up and says, today I want to have a heart attack. But a lot of people wake up with heart disease. No woman wakes up and says, today I want to be diagnosed with breast cancer. But most cancer is in the body for years before it becomes diagnosable. So to have a test to know exactly how resilient is the body, how healthy is the body, is so important.
Which leads us into biomarkers.
Exactly.
Talk about that.
So biomarkers we use a bunch of different biomarkers in our office, but some of the important ones like blood work. One of the things we use is something called triglyceride to HDL ratio, and everybody should know this ratio. Everybody knows their cholesterol, but triglyceride to HDL ratio is 17 times more predictive of a heart attack or a stroke. So that's one of the biomarkers. We look at body mass index. We look at waist to hip ratio, which tells us how much belly fat a person's carrying, which is a cause of chronic disease. So we take all of this stuff, we put it together in an overall wellness score, give this person a wellness grade. And it's surprising. A lot of people are asymptomatic or getting F's and D's on their wellness score, which means they're headed towards chronic disease.
I always heard, we have just about out of time, that if you have a certain belt size, depending on what that number is, you need to get checked out.
Without a doubt, and that's what the wellness score will tell you.
You're the man. Thank you, sir.
You're welcome.
There you have it.